Okay, so what we're going to be talking about here is the advanced version of the four wheels. We can throw in that fifth wheel for a little bit of finesse and channeling from side to side. So it is a little, like I said, a little more advanced. And we're going to go through several versions of this where you can progress this depending on where you're at with your skill level. You just want to build off of some of the other videos that are already established with the four wheels and maybe the fifth wheel too, to be able to channel a little bit from side to side, and make sure you don't hold your breath and make sure you're not overstressing, overstraining, or that there's not too much pain. But the idea is to channel these wheels. I'll show you here, like your hip up in the front. We're gonna focus more on this now. So kind of driving down in the back and the glute and lifting up from like the belt buckle area from the abdominals, and then feeding up into the abs, or sorry, the hip flexors when you lift in combination with the abdominals to channel up. Now we're also gonna look up here. The pecs have to let go and the scapular muscles are gonna pull back and down, especially the lower trapezius muscle to pull down to leverage that shoulder blade. So I wanna be lifting up in the front, lifting up, pulling down, and then anchoring down through here. But now we're gonna add in and resist even using the hand to channel that a little bit better. But you do need to lock in those lower ribs. That's another video you might wanna check out, is the lower rib kind of anchoring there, because that just keeps you from arching your back and then you'll lose all that. But the shoulder can certainly help to feed the pelvis and vice versa. But you gotta keep that tread going around with those wheels turning and channeling that, at least within the torso. All right, so here we go. So I'm gonna lie down here. And so again, like I can push through my heels, get my glutes, and try to get like a pelvic tilt in combination with the abdominal muscles, kind of there. And my lower ribs, I really wanna anchor those, keep your head relaxed, okay? And I can channel my arm, and in this case, this shoulder blade is gonna pull down. So I can kind of do both together here, a little further there, and anchor here, okay? So the difficulty now is if I shift from side to side, I'm gonna rotate here. Now this is gonna lift up as I go to the right, but I still wanna keep tension. So the example would be that when I shift, I'll go to the left first, I'm gonna anchor, I can lift into like a bridge here, and then I can leverage through and lift my right leg, okay? But the channeling in the direction, that's still the same on both sides. It's just how much movement are you allowing and which muscle group are you biasing, either the glutes or the abdominals here, and the hip flexors. So in this case, I'm going to, we'll say I test that, and this is weak and difficult, especially against resistance, like I can win my hand, like that's not very good. So I'm probably not anchoring here very well. But again, I would naturally be shifting a little bit to the right to leverage to lift here, to get that. So I wanna be there, but I gotta keep tension on the left to anchor, and I can just use my hand here and feel that, my opposite hand, and try to get there. So that's better, I can feel that engage. Even as I lift up, I don't lose strength there, and it makes me more stable. And I can switch here and do the same thing. So I really wanna be able to channel that. And if I can't get enough there, I might have to look at my shoulder as well. Then when I pull that down, that feeds there. But again, I gotta anchor here, feed it down into that glute maybe to channel the glute better. Or if I'm coming up this way, to channel that better, to use the there. And both of these can be applied in an upright position as well, but that should be helpful to get everything going, grease the wheels, and create more functional strength and less pain. And also not compressing so much in that low back, keep that open. Really helpful for that as well.